Good day, everyone. Today I am going to discuss to you a communicable disease, which is tuberculosis. First, what is tuberculosis? Tuberculosis or TB is a potentially serious infectious disease that mainly affects your lungs. The bacteria that cause tuberculosis are spread from one person to another through tiny droplets released into the air via coughs and sneezes. Tuberculosis is an airborne disease. About 1 million Filipinos have active TB disease. It is a highly curable disease, yet it is the number one killer among all infectious diseases. Every day, more than 70 people lose their lives to TB in the Philippines needlessly. Many of these patients develop drug-resistant tuberculosis, which are more expensive and difficult to treat. Bacterial agent of TB. It is a disease caused by bacteria called Mycobacterium tuberculosis. The bacteria usually attack the lungs, but they can also damage other parts of the body. Next is the type of tuberculosis. Latent TB infection. Many of those who are infected with TB do not develop overt disease. They have no symptoms and their chest x-ray may be normal. The only manifestation of this encounter may be reaction to the tuberculin skin test or interferon gamma release assay. However, there is an ongoing risk that the latent infection may escalate to active disease. The risk is increased by other illnesses such as HIV or medication which compromise the immune system. Active TB disease. Active TB is an illness in which the TB bacteria are rapidly multiplying and invading different organs of the body. A person with active pulmonary TB disease may spread TB to others by airborne transmission of infectious particles coughed into the air. If you are diagnosed with an active TB disease, be prepared to give a careful, detailed history of every person with whom you have had contact. Since the active form may be contagious, these people will need to be tested as well. Miliary TB. Miliary TB is a rare form of active disease that occurs when TB bacteria find their way into the bloodstream. In this form, the bacteria quickly spread all over the body in tiny nodules and affect multiple organs at once. This form of TB can be rapidly fatal. Next is the pathogenesis of tuberculosis. The cycle of TB infection begins with dispersion of Mycobacterium tuberculosis aerosols. A dose of 1 to 10 bacilli are dispersed throughout the air, making the risk of transmission likely. In the patient's lung, the bacilli are phagocytized by alveolar macrophage cells, which then invade the underlying epithelium. Here, monocytes from nearby blood vessels form the beginning of a granuloma, as the immune system attempts to ward off the disease. This is a hallmark characteristic of tuberculosis. Within the granuloma, a core of infected macrophages is surrounded by foamy macrophages, mononuclear macrophages, and lymphocytes. The result is a fibrous capsule with increased foamy macrophages, presumed to create the typical caseous debris or necrotic tissue resembling cheese in the center of the granuloma. Although it appears contained immunologically, the caseous center tends to liquefy and cavitate as it empties thousands of Mycobacterium tuberculosis bacilli into the airway. The cycle is complete as the damaged lungs produce a cough that once again contains the highly transmissible infectious droplet nuclei. Although our body may harbor the bacteria that cause tuberculosis, our immune system usually can prevent you from becoming sick. For this reason, doctors make a distinction between latent TB. In this condition, you have a TB infection, but the bacteria remain in your body in an inactive state and cause no symptoms. Latent TB, also called inactive TB, isn't contagious. It can turn into active, so treatment is important for the person with latent TB and to help control the spread of TB. And for the active TB, this condition makes you sick and in most cases can spread to others. It can occur in the first few weeks after infection with TB bacteria or it might occur years later. Here are its signs and symptoms. Signs and symptoms. Signs and symptoms of active TB include coughing that lasts 3 or more weeks, coughing up blood, chest pain or pain with breathing or coughing, unintentional weight loss, fatigue, fever, night sweat, chills, and loss of appetite. Tuberculosis can also affect other parts of your body including the kidneys, spine, or brain. When TB occurs outside your lungs, signs and symptoms vary according to the organ involved. For example, tuberculosis of the spine may give you back pain, and tuberculosis in your kidney might cause blood in your urine. Diagnosing the patient. The most commonly used diagnostic tool for tuberculosis is a simple skin test, though blood tests are becoming more commonplace. A small amount of a substance called PPD tuberculin is injected just below the skin of your inside forearm. You should feel only a slight needle prick. Within 40 to 72 hours, a healthcare professional will check your arm for swelling at the injection site. A hard raised bump means you're likely to have deep infection. The size of the bump determines whether the test results are significant. Result can be wrong based on the test that the patient has taken. The TB skin test isn't perfect. Sometimes it suggests that people have TB when they really don't. It can also indicate that people don't have the TB when they really do. Blood tests. Blood tests may be used to confirm or rule out latent or active tuberculosis. These tests use sophisticated technology to measure your immune system's reaction to TB bacteria. A blood test may be useful if you're at high risk of TB infection but have a negative response to the skin test, or if you've recently received BCG vaccine. Imaging tests. If you've had a positive skin test, your doctor is likely to order a chest X-ray or CT scan. This may show white spots in your lungs where your immune system has walled off TB bacteria, or it may reveal changes in your lungs caused by active tuberculosis. CT scan provide more detailed images than do X-rays. Sputum tests. If your chest X-ray shows signs of tuberculosis, your doctor may take sample of your sputum, the mucus that comes up when you cough. The samples are tested for TB bacteria. Sputum sample can also be used to test for drug-resistant strains of TB. This helps your doctor choose the medication that are most likely to work. This test can take 4 to 8 weeks to be completed. Treatment. The National Tuberculosis Program in the Philippines is an approved DOTS program. In the Philippines, effective anti-tuberculosis drugs such as isoniazid acid, rifampicin, pyrazinamide, ethambutol, and streptomycin are available for free of charge through national and local government health centers or the Philippine Department of Health. How is latent TB treated? If you have become infected with TB but do not have the active TB disease, you should get preventive therapy. This treatment kills germs that could cause problems if the disease becomes active. How is active TB treated? If you have an active TB disease, you will probably be treated with a combination of antibacterial medication for a period of 6 to 12 months. The most common treatment for active TB is isoniazid acid INH in combination with 3 other drugs such as rifampin, pyrazinamide, and ethambutol. Drug-resistant TB. Drug-resistant TB means that some drugs initially used to treat TB will no longer be able to fight the TB germs in your body. TB that is resistant to more than one drug called multidrug-resistant TB is very dangerous. The treatment for this type of TB takes much longer, up to 20 to 30 months to complete, and you may experience more side effects. Prevention. If you test Positive for latent TB. Your doctor may advise you to take medication to reduce your risk of developing active tuberculosis. The only type of tuberculosis that is contagious is the active variety when it affects the lungs. So if you can prevent your latent tuberculosis from becoming active, you won't transmit tuberculosis to anyone else. Protect your family and friends. If you have active TB, keep your germs to yourself. It generally takes a few weeks of treatment with TB medication before you're not contagious anymore. Follow these steps to help keep your friends and family from getting sick. Stay home. Don't go to work or school or sleep in a room with other people during the first few weeks of treatment for active tuberculosis. Ventilate the room. Tuberculosis germs spread more easily in small closed spaces where air doesn't move. If it's not too cold outdoors, open the windows and use a fan to blow indoor air outside. Cover your mouth. Use a tissue to cover your mouth anytime you laugh, sneeze, or cough. Put the dirty tissue in a bag, seal it, and throw it away. Wear a mask. Wearing a surgical mask when you're around other people during the first 3 weeks of treatment may help lessen the risk of transmission. Here are my references, and thank you for listening.